Bonsoir. اسمي روي مطران. So I'm a dermatologist in Beirut. It's a pleasure to be here again بجدة as I visit frequently في جدة والسعودية, but it's always a pleasure to be with you guys. Today we're gonna talk about a new concept, a new product. Really, it's something new, c'est une avancée, يعني شيء جديد بعالم نحن بنشتغله. So we all work in cosmetics, we all use fillers, we all use toxins, but we all know that there's always new things, new technologies, new brands, new products. Our job is to give our patient the best thing, the best result with our best hands, but to give the result to the patient, we have to have the best product too. مشان هيك اليوم رح نحكي عن a new product. We all know there's a lot of products, كلهم hyaluronic acid. We know there's differences between this product and the other, but this, what we're gonna talk about today, it's a complete new word in hyaluronic acid. الفرق, it is a product that is safe, very safe. It gives excellent results, long-lasting. So we're going to talk about all these properties. كمان, it's a wide range that gives us the advantage to work on every part of the face, to work on every part of the body sometimes, with a wide range of products, and again, with the most important thing, it's very safe. So, شو الفرق? What's ZHOABEX? Actually, the product by itself differentiates on other products هي من التكنولوجي تبعه or how it is done. So it's a combination of 3 hyaluronic acid, 3 poids moléculaires, 3 molecular weights, كل واحد عنده different properties, وبكل product there's difference between each one of them to give the properties of each product. We're going to discuss the whole product that we have. It's a very pure product. It's very safe. And c'est un produit qui est très biocompatible. شو يعني biocompatibility? It makes the product integrates well into the skin without giving side effects. We know, all of us, we've been treating patients with hyaluronic acid, and I'm sure that all of us, we had side effects. ما في حدا يقول لي no side effects in hyaluronic acid. We see side effects. The more the products فيه sorry مش عم يطلع صوتي؟ ها؟ ما فهمت عليك. عم تحرك كتير؟ Okay. The more we're injecting filler, the more we're gonna see side effect. This is for sure. The advantage of this product, هلا حنحكي عنه, how it is composed. التكنولوجي تبعه makes it less, يعني بيعطي much less side effects. We're gonna talk about these things. كمان, the other advantages is كمان stability, durability, how it can correct three-dimensionally the gaps or the wrinkles. عم بحكي تيوريك شوية. لازم نعرف شوية عن التيوريك تبع البرودكت, but this is definitely not what I aimed in this presentation. رح أعطيكم شوية تيوريك just for you to know what is the advantage of the product. But the most important thing, how we're going to inject this product. Okay? So, we have many sub-brands. We have the Soft Touch. It's a very nice product لأنه it has the 3 hyaluronic acid, the 3 chains of hyaluronic acid. في عنا light lines. It's a very light product. So we have the lips. That is not available, right, Tony? That's not available, the lips. Lips, it's a very soft product. So we're going to go directly to the deep and the volume product. So it's a wide range of 5 products that can give us a full range of treatment for the face, and sometimes we can use it for the hands, for the neck, for the décolleté, and I use it a lot for the décolleté. I use it sometimes for the knees, for the elbows كمان. The difference is, مثل ما حنشوف بهذا التابلو, إنه كل product عنده propriété له, أو each product has its own components. So بنشوف إنه soft touch, بنشوف it has 3 molecular weights, بينما light lines, deep, رح نقفل lips, deep والvolume, it's 2 molecular weights. The product by itself بيجي 1 ml syringe, and the cross-linking أكيد بيفرق بين product. كل ما يعلى كل ما يسمك البرودكت, we have a higher cross-linking. So The soft touch is we're gonna discuss each product, the properties of each product, and we're gonna use it on patients. So the soft touch has the advantage of being a filler. وأهم شيء, it's a biostructuring product which can give us a natural lift effect. Light lines, so Kamena, it's another product, number 2, which is, it gives us a soft volume. It can be used for soft wrinkles. We're gonna inject light wrinkles. We can use it on the forehead. We can use it on the glabella. We can use it on the marionette. Whenever we're looking for a light filler, this one can give us a very good result. We can use it on the periocular wrinkles, Kamena. You know, when we inject toxins and we still have the wrinkles موجودين, we have to go for fillers, hyaluronic acid. In this case, we can use the light one, the light lines. So here, we're showing here how we can use it on the periocular area. Sorry مع صوت الميوزك مش هيطلع كتير صوتي. It shows how we can use the light lines on the periocular area. So as I said again, whenever toxins doesn't give us the result that we want, which is بنشوف كتير, we're seeing a lot of patients at a certain age, toxin will not give us the result they expect or that what we want. In these cases, we can use the light lines on this indication. Particularly, it has a very it's a safe indication if it is used wisely, and it gives an excellent result. That is Kamena, that lasts for at least 6 to 9 months. Kamena, one very interesting indication is scars. So we know that whenever we're talking scars, we are looking for 2 things. تعرفوا نحن وقت we have acne scars, what do we do usually? We suggest laser, we suggest biostimulating agents, لأنه we want something to re-stimulate the skin, to rejuvenate, to fill the gaps. صح؟ متفقين عليها هيدا, right? So we want a filler. So we want hyaluronic acid that will give us a volume to fill the gap, but we want also a product that will re-stimulate our own collagen or the collagen of the patient to fill the gap by itself. That's why we have to use the light lines, لأنه actually it gives us this advantage of treating on directly and on the long run to create the own collagen. So we can see how we inject superficially. نحن عم نحضر الفيديو. I'm going to talk about something different. I think we all have used products that has very high concentration of PBDE. It's a low molecular with high molecular. Each product بيشوف حاله each company they're happy to create a product that has certain advantages or certain properties with the BBDE, with the high molecular weight, with the low molecular weight, but we also see in these products a lot of side effects. The advantage, شو هن side effects? Actually, side effects, we have the infections, and mainly, أهم شيء, we have the late onset granulomas, or post-inflammatory granulomas. We see patients that have been injected for years, or she stopped injecting like 2 years ago, and then she comes someday with a lump on the face or under the eye, which is actually a late onset complication of the filler. So why we have these late onset complications? Because the filler by itself, it's pure hyaluronic acid, it's true. But it's not the most natural hyaluronic acid. So it is combined, it is added, it's added on BBDE or other low weight or high weight hyaluronic acid that makes the filler by itself can create in a few months side effects. The advantage of the product, the BBDE اللي هي by European laws, هي لازم تكون 2 per million. So the ZHOABEX has the properties إنه خففوا كتير BBDE. So whenever we have much less BBDE, they have the technology. So عملوا التكنولوجي إنه يعملوا أقل بكتير, بس the technology made it last long. يعني with less BBDE, it doesn't mean that will not last long. And technology is completely different. But this is the advantage of it. It will give us much less side effect, which is very, very important. لأنه patients will not understand that we did the right job. They will blame us as doctors. إيه أنا عملت فيلر ورحت عند دكتور إكس وعملت فيلر وبعد سنتين عملت side effect أو بعد 6 أشهر عملت side effect. The doctor did his job. He used a good product, but we have side effects. So that's why one of the way of thinking in our practice is not only to give a good result, but to think about the safety of the product, which is very, very important nowadays because we're injecting a lot. Everybody's getting injected. We're injecting a huge amount sometimes of fillers in some faces, and we have to think about safety and long-lasting, less side effects. So the light lines can be used for the forehead. By the way, it's a very nice indication. You know that in ladies, whenever we have the forehead that is concave or مجور, it gives a little bit of a masculine forehead. So that's why we have to go for a soft filler somehow to inject it with a cannula under the muscle, under the frontalis muscle, to give somehow a more bumped or a more concave curved forehead. So this is a very good indication, Kamena. We can use it, Kamena, for the glabella. Whenever toxins fails, Kamena, we can use it with the glabella. We can use it for the forehead with a cannula. It's very important not to take a risk whenever we're injecting the forehead. The arteries in the forehead كتير مشرعبين. So it's not مش مثل the other arteries. We know where they are. There's very small arteries all over the forehead. بيطلعوا deeply. So that's why it's risky somehow to do the filler of the forehead with the needle. That's why definitely we prefer to do it with a cannula to be on the safe side. We can use it, Kamena, one of the most common indications in under eye fillers. So let's talk about under eye fillers. Under eye fillers, the majority of the patients, they come to the clinic for 2 indications, which are أغلبيتهم they are wrong. They come for the lips وبيقولوا لي عيوني تعبانين. Okay, so عيوني تعبانين شو يعني عيوني تعبانين? When a patient say ما بعرف كيف بدي أقولها بالإنجليزي عيوني تعبانين, they have tired eyes. What is tired eyes? Tired eyes can be colors. Okay, so we know that hyaluronic acid somehow can rejuvenate the skin and give us a better color. Whenever we have a real tear trough depression, يعني وقت يكون عندنا جورة تحت العين, this is the perfect indication for under eye fillers. And whenever we have bags, so only the 3 points that we can see under the eyes. Sometimes we see the 3 in one patient, sometimes we see 1. So again, if we have lone, just the color, we have to ask the patient to be treated by the dermatologist to treat the color. But we know that hyaluronic acid can help us rejuvenate the skin and the color will get better. When we have a real tear trough, يعني عندنا جورة حقيقية, we have to inject usually a filler اللي هو light lines. Light lines would give us an excellent result in terms of side effects, less complications, and in terms of longevity of the product. How we have to do it? كمان it's very important to do it properly. Doing properly يعني use the needle or the cannula. I personally prefer the cannula because to have less hematoma or less bruising. But the most important thing to keep in mind that we have to go deep. When I say to go deep, is to really go deep, is to inject under the muscle. So whenever we go the cannula, we have to feel that we are crossing the orbicularis oculi muscle, بنقطعه, بنخزقه. And then we inject to keep the product in its place, knowing that the orbicularis oculi muscle is a muscle that is actually striated muscle. So we have the fibers of the muscle, it goes like this. So بيعملوا contraction. So with age, there is بيسموه dehiscence أو بيفتح العضل. So بيفتح العضل. So with time, we have the filler that is going outside the muscle. So it goes directly under the skin, which will create for us what we call the Tyndall effect. So Tyndall effect can be done or can be due to two things. Or a superficial injection from the beginning, which is considered wrong. مثل ما عم بقول, we have to go deep. Or the product by itself, شو ما يكون, will migrate through the muscle to go under the eye. This is, in these cases, ما بيكون لا حق على البرودكت ولا حق على الحكيم. It's the anatomy of the patient. We can dissolve it. هلا تنرجع على treatment of the under eye filler. Under eye fillers, مثل ما قلت, so we treat the tear trough with light lines, and we can treat كمان the bags. How we can treat the bags? The bags, the eye bags, the treatment of it is أكيد surgical. So we know the best thing to do. We have to go to a surgeon, plastic surgeon, to remove for you the eye bags. But there are some patients who have somehow a stage 1 of eye bags. بعدهم مبلشين جديد. So we can do two things actually. We can go for surgery, or we can try to treat with the light filler specifically under the bags to hide them. So that could be a good indication to be used whenever we have stage 1 or even a stage 2 of eye bags. We can use the light line fillers, come in with the cannula. So as I said, we have the lips. That is not, for the moment, it's not available in KSA. It's a very good filler كمان, but it doesn't give the volume that we usually ask for. So we know that our patient, whenever they do the lips, they want a big volume somehow. So that's why usually in the lips, we use either the deep or the volume filler. لأنه it will give us the volume that people are looking for, and keeping it very, very natural because of the moldability and because of the integration of the product. How we do the injection, how to do the lips, it depends on two things. It depends on the patient's what they want, يعني their choice, and أكيد definitely our job is to explain to the patient what will give you a good result. And the fourth thing, أنا برأيي, it's very important, is to take a picture of the patient وهنا عم يطلعوا profile, because when they look at themselves, هنا بيطلعوا حالهم بالمراية هيك. So they take the mirror and they look at themselves like this, so they don't see how the lips are projecting with time. So one of the models now, كان ما بعرف وينها هلا, she has, أنا برأيي, already big lips. And for me, it's not nice. It has to be natural. So I was discussing a little bit what she wants. عم بقول لها we can do ونقزة نقطة. طب يا أختي, ما هالنقطة ما حتعمل شيء. ليش مصرة تعمليها؟ إذا حتعمل شيء حتبشرك أكثر ما حتفيدك. بس كمان أنا ضمن شغلي أول مرة بقول لها بفسر للبيشنت, لأنه بتعرفوا الشغل مع النسوان. The first time I tell her you don't need. The second time I tell her you don't need. The third time I tell her you don't need. If she insists بعملها خلص, it's her face. بس it's very important, the message, and it's very important to show them, لأنه what we actually are seeing in the Arab world, it's something that is somehow disgusting, لأنه people are over treating their lips, over asking for lips. So keep in mind, a natural lips are not the projected big lips. We have to treat them, we have to correct for them their lips, but not to over treat them. We can use the Russian techniques. يلي هي كمان Russian lips shouldn't be done for every patient. There are certain indications, there are certain lips بيلبق لهم the Russian lips, while other indications are already projected أبدا ما بيلبق لهم. Let's go now to serious things. The thick volumizing products. We have the ZHOABEX Deep. So كمان it's a highly cross-linked hyaluronic acid that can give us a good volume that can help us reshape a face. So this is where we are now in the era of reshaping, restructuring, recontouring of the face. And this is how we have to look at the patient and use the best product that can give us the shape that we're looking for. Again, we're not in the era of the very tight, very strong structurally we used to see a few years ago. Now we are looking more for a natural, soft faces. ما بعرف هيك عم بيصير معكم. But actually, in my practice, if I go back 5 to 10 days, 10 years ago, we used to be very happy by structuring, giving the high cheekbones, the very defined jawline. This is the beauty. What we are using now, same products, but in a different way. So we have to think differently how we can contour a face in a natural, smooth way, not the very strict and very hard shapes. The ZHOABEX volume and the ZHOABEX Deep are very helpful in these cases. We can inject it. We can use them to inject the nasolabial folds. مثلا, we can inject the chin. Volume is more volumizing. You can use it for the cheekbones. We can use it for the jawline. And a very nice indication for the volume filler is whenever we inject it through the cannula on the lateral part, or GW2, اللي هي jawline الفوقانية, the lateral part of the jawline. It's practically the only point that can lift without giving volume. So we all know if we inject ZHOABEX volume here, we will have a volume and we will have a lift, but we will have a volume. قد ما نقول it's a lifting point, we all know adding hyaluronic acid on the bone will give us volume, which is fine sometimes. But if we have faces that are very well defined, they don't need volume, but they need somehow a lift. This is where we have to think differently, to choose points that will lift the face without giving volume and using the appropriate filler. Appropriate filler, I mean by that ليش volume is the appropriate filler in this case, لأنه it holds in its place, it will not diffuse. So if we go with the cannula, we'll definitely have cases of where I'm going to do it. So if we go with the cannula 22 gauge into this area and the lateral part of the jawline to lift it up, it will not give us volume. Keep it in mind, please. Nasolabial fold, we can use it مثل ما قلنا بالZHOABEX Deep. It's a very good indication. This product is a very good indication for this. This is a very good product, sorry, for this indication. كمان, as I said, deep and volume can be used to restructure and recontour the face. مثل ما هون عم نقول mandibular area, zygomatic area, chin also. How to do it actually, there's no right and wrong. في ناس بتستعمل دكتور بتستعمل كانيول أو needle. Cannula. Okay. So is it wrong to use a needle? No, it's not wrong. So it's a personal choice. So مثل ما بتستعمل كانيولا. أنا recently I used to be very, very, very needle doctor. I used to use a lot of needle. هلا recently I shifted, especially on jawline, to use the cannula because again I was looking to give very sharp. So I was giving big volume to sharp. هلا whenever I'm working more lightly, softly أكتر, I think it's better to use on the jawline a cannula بتعطينا هيك a softer product, a softer look. While on the cheekbones بعدنا بستعمل النيدل honestly لأنه I think it targets better on the bone. لأنه كمان ما ننسى الاناتومي على الزيجوماتيك arch دغري تحتها في we have the artery circumflex or circumflex artery. So we have to be sure that we are on the bone. And again بدي لكم شغلة, whatever we're doing, whenever we say it's safe, nothing is safe 100%. We have to know our anatomy. Take less risks. لأنه شفت recently a case, a chin filler done by a 22 gauge cannula. So 22 gauge cannula, which is considered, نحن بنقول it's very safe, right? So no, it's a huge, كبيرة. So it would never penetrate an artery, صح? 22 gauge cannula, the chin and the cannula and the big one, and I saw a small necrosis because of the cannula. So nothing is safe 100%. Anatomy is very important whenever we're injecting. Volume, so it's a three-dimensional volumetric correction مثل مكتوب, but it has a very long-lasting effect, which is very important with less side effects. ليه عم بقول it's very important؟ لأنه other products, without naming them, they can give us a very long lasting efficacy. بس au prix de quoi؟ بسعر شو؟ We are using a product فيه كتير BBDE, فيه different types of low molecular weight and high molecular weight that is giving us, with time, more side effects. So this product, on the contrary, on the other hand, it is long-lasting, but the most important thing, it has less BBDE. So the technology of creating this product was completely different to give us long-lasting and less side effect. And by insisting on this, I'm still insisting, I'm talking about it أكتر. لأنه the more you work, the more you inject, the more you will see side effects in few years. بيجوا عندنا patients, I injected them, من يومين شفت a patient that I injected him 2016, 2017. I saw his file يعني. So he said he never been injected. أنا بدي أقول مش عم بيكذب الزلمة. إنه probably مش جاي يكذب علي. He never been injected, and he started developing small lumps, inflammatory lumps on his cheeks. So I had to dissolve, give a small course of steroids, and I'm sure it will be fine. بس نحن واجبتنا is to try to avoid even these small side effects. As I said, ZHOABEX volume is a perfect product to be injected on the cheekbones. Rhino filler. هلا كمان it's one of the biggest thing. We don't do surgeries, we just to do fillers in our nose. We correct the non-surgical nose correction or the non-surgical or the medical rhinoplasty. We have to do it because the demand is growing. Especially in the Arab world, نحن خلقنا من خيرنا بشعين بالميدل إيست. يعني we have a lot of lumps, we have a lot of bones. So the majority of our patients will ask for nose fillers. هلا here in this slide we're gonna talk about the deep and the volume, which is fine. I totally agree, 100%, excellent product, but we have to go deep. And if we go deep, we have the risk of touching an artery. Especially in patients اللي عملوا already surgical rhinoplasty, so we don't know anymore the real anatomy of the vessels. It's more complicated. So I'm going to go with what they told me, or what is written in this slide. We have to use volume or deep, which is again 100% correct. But I'm going to tell you something. We can use the light product. ليه؟ لأنه hopefully we can يكون عندنا a case. If we're going to use the volume or the deep product, أكيد we have to go deep. While if you use the light one, we have to go superficial. And if we inject into the skin, so I'm not going under the skin. If we're going to use volume, by the book, a volumizing product should be injected on the bone, subdermis, تحت the subcutaneous area. While the light one, we can use it intradermally or a little bit in the mid-dermis. So this is a good indication whenever we're a little bit خايفين. Should I go deep? I don't know the vessels. I did 2 times rhinoplasty. So we can use the light one. بس شو بنعمل ساعتها? We hold the skin and we inject in the skin. So in this case, when you وقت بنرفع الskin, the artery will not go up with the skin. The artery will stay on the bone. So whenever we lift up the skin and we inject a light product into the skin, we have certainly a good result that will last أقل لأنه it's not a deep product, but it can be a choice whenever we are confused while injecting the nose fillers. So the nose fillers, I would say volume and deep are very good, but the light can be used in certain indications. how to inject. أكيد في كتير slide how to inject, بس رح نقفيهم لأنه I'm gonna show you how we're gonna use each product for each indication. We can use, by the way, it's very important كمان, whenever we're using the deep and the volume, we can use a multi-layer technique, which is very important. Let's say we have a big sagginess on the jawline of a patient. We have الباجو, بيسموه الباجو, so it's very saggy. We have to create something to give her somehow a lift on the lower face. So injecting the jawline is a very good idea. Injecting the point اللي قلت لكم عنه يلي تغرق قدام الدين, it's a very good indication. But what do I mean by multi-layer technique? Actually, you can go with a volume product very deep on the bone, because it has to be very deep. Give the patient the product that she needs, like 0.5 or 1 ml, it depends on the case. And in addition, we go through the cannula again, we go out with the cannula, and we go a little bit more superficially under the dermis, using the ZHOABEX deep lay. لأنه actually we'll be holding the skin in two areas, dans deux plans, in two different levels. So we're giving the volume deep, and we're holding the dermis or the subcutaneous, the under dermis area with the deep. That would give us a better shape for the jawline, and it will hold better and will give us a better result. So this is what we call the multi-layer technique, which is كمان very important. So how to inject. Everyone has technique. مثل كنت عم بحكي مع دكتورة, في ناس بيحبوا الكانيولا, في ناس بيحطوا الفانينج تكنيك, في ناس بيحبوا المايكروبوليس. But we have to know أكيد the light product فينا نستعمله مايكروبوليس أكتر. While we go with the deep product فينا نعمل fanning technique. أو هيدا اللي عم بحكي عنه actually. This is how we can treat the jawline with either the volume or the deep, or in combination, especially in patients they can afford to do more than 1 or 2 injections. Let's go for a multi-layer. It gives an excellent result. As I said, it can be done either with a cannula or with a needle. As for the lips, many techniques, many ideas. Either we do contour, either we do volume, exactly the volumizing area in the muscle. You can choose 2 products by experience. You can choose the deep or the volume. Both of them will give you a good result. Volume will give us more volume. So both of them are very useful in the lips, deep with volume, but it depends on the patient, what she has and what she's expecting, and what do you prefer in your hands. We can use one of them. مثل ما قلنا هون, ZHOABEX volume can be used dans le corps, in the middle of the muscle of the lips. And we can also use a lighter product on the contour. 4 points, 3 points, there's a lot of technique. I use 3-point technique. Here 1 point in the middle of the lower lip, 2 points اللي بنعملها in the upper lip. It is very convenient here. It's a 4 points technique كمان. It can be used to inject the lips with the needle or with the cannula. So as we're saying, nose filler, we discussed it. Very important to make sure that we are not. تعرفوا النوز بيسموها circulation terminal. What does it mean, circulation terminal? It means إنه الانستوموز or the creation of the new vessels بتصير كتير بطيئة. What is it? When we hit an artery, okay? If it is a big artery, we'll have the necrosis. It's sad. We're unlucky enough to have a complete necrosis. Whenever we have ischemia, it is less than the real necrosis. Actually, what happens? We hit the artery. We have the filler in the artery. But what happens is the body, the skin, will create another vessels from small vessels, capillaries, from another big arteries to compensate. نعرفها هيدي صح? So whenever a part of the skin is dead, or an artery is obstructed, the other arteries اللي حوله will create with time small arteries to give the blood to this skin اللي it was dead because of the filler. So in the nose, usually it happens rarely. لانه there's vascularization اللي بيسموها terminal يعني we cannot have a good anastomosis بعدين or small capillaries. That's why we have to make sure that we're doing it safely, and as I said we can use one of the 3 products for the nose depending on the case. هلا احنا عم نفرجيكم اياها back arrow technique. I'm gonna show it to you while we're using it. The light lines again we can. So there's protocols. Protocols are made just to have an idea, not to do it on every patient. So it's your technique, it's your experience that will make you use the filler in a way. So this is a back arrow technique اللي بتشوفوا كيف it's 7 points. We can see how we will inject مع the quantity. We can go for 1 ml per side. These points إذا بناخذ الاناتومي تبعهم because we know that we can be sure that we are a little bit outside or far from the big arteries of the face. We discussed this. The chin. We can many techniques for the chin كمان. We can have a projection, we can have an elongation. What's the difference? It depends on the face. So if you have a menton fuyant يعني الدقن راجع كتير لورا, we can project it by injecting the volume filler. While if you want to elongate it, the face we think that it needs elongation, we can use the volume or the deep ZHOABEX to elongate or project it. Marionette lines, كمان, this is a technique that's very famous, the back arrow technique, but it is not done for every patient. Whenever we have a lot of sagginess here, we have to avoid doing this 3 and 6 points. So we'll do 1, 4, 7, 2, and 5. Fillers, مثل ما قلنا, restructuring, contouring, lips, lines, many indications. But there's an indication that is, people are asking more and more about it, how we can treat our skin. Treating the skin is not only creams anymore. Creams are very important, vitamin C, vitamin E, tretinoin or retinol. It's very important to combine everything we're doing with the creams. But we have to think, Kamena, differently. There are new products that will treat the skin from inside as biostimulating agents. So we have the soft touch ZHOABEX, which is, مثل ما مكتوب هون, and it's very important, it's cross-linked. ليه عم بقول it's cross-linked? If we compare with non-cross-linked products, شو هن البروتوكولز? Some say we have to do it every 3 weeks, a product. Another say you have to do it every month. Another one, هلا مش عم سميهم بس we know that one of them بيقولوا لك every 3 weeks. Another one بيقولوا لك every month. Another protocol is every 6 weeks. But because soft touch, it's a cross-linked hyaluronic acid that will give us the same advantages of a biostimulating or hydrating product, but because if it is cross-linked, we don't have to do it so frequently. So patients عم يستفيدوا, they are paying less, they are being injected less. The protocol says 1 ml per side, and then we can repeat it in 6 months. For young people, we can use 1 ml half per side, but this is not very recommended. Usually patients they expect to see quite a good result. So we can go easily for 1 ml per side to give a better and a faster result. How to do it? So these are the 4 points that we have to use. أكيد, this is how we say the safe, easy way to do it. Can we do it otherwise? Yes. It depends on the patient. It depends how to do it. Sometimes I do use cannula superficially for this indication. كمان مش غلط. So many ways of doing it. This is the most conventional and the simplest way. You can keep it in mind. Safe, easy. We have 4 points. إذا بدنا فينا بدل ما نعمل 2 على eyebrow, we can do it with a fanning technique. بين ال 1 with 2 كمان, it is a way of doing it. The advantage of the soft touch إنه فيه 3 molecular weight hyaluronic acid. So it's the only product اللي فيه 3 ثلاثتهم. This way, we are sure that we are working on the 3 layers of the skin. We are hydrating the epidermis, we are hydrating the dermis, and we are working on the hypodermis. So this is the advantage of soft touch. So the advantage is 2 things. First of all, again, I'm saying it works on the 3 layers of the skin. Second, it's a cross-linked hyaluronic acid, so we don't have to repeat it frequently. Just once every 6 months will give us the result that you are expecting. So these are the 4 BioLift points that we have to keep in mind and do it to our patients every 6 months. Lay these points, we show these points actually because we know that, again, if we go by anatomy, if we inject these points, we are practically sure that we are not crossing vessels and nerves. So here, okay, so 4 points again, and the protocol says 0.15 to 0.1 to 0.15. This is the protocol if we're using 1 ml for the whole face. Again, I would rather go for 2 ml for the whole face because it gives us a better result to be repeated in 6 months. This is, by the way, a product that can be used in all other indications. It's not only reserved for the face. We can use it on the neck. Excellent product for the neck. Whenever بتعرفوا اوقات the neck, we don't have any, we can use toxins sometimes, we can use biostimulating agents, but soft touch can give us an excellent result for the neck. We can use actually 1 to 2 ml, but I would go for 2 ml. On a different point, we can inject like 5 points per side to use, so we're gonna use 2 ml on the neck. So as I said, 4 to 6 months, we can repeat the treatment. And due to the 3 molecular weights of hyaluronic acid, it treats the whole skin before the 3 layers. So we can see how we are injecting 0.2. On 0.2, it's 0.1. Again, if 0.1, if we're using 1 ml for the whole face, we can double the amount if we're using 2 mLs for the whole face. So 0.4, the 4 points where they are. But كمان, if we use the cannula, we can practically use the product all over the face in an easier way. The product كمان, again, we can use it كمان under the eye. So how we can do it? Actually, مثل multi-layer technique that I talked about in the jawline, if the patient can't afford to do it, we can use the light one deep under the muscle, and with the same cannula, go back, change the needle, and extract the soft touch superficially. It works on the depression, أكيد, but it works on the quality of the skin. It works on the small wrinkle, the fine wrinkle, and it works on the color. It's very important, كمان, whenever we're combining 2 products with the same indication. So soft touch, it corrects the small wrinkles. With the fillers, when we go deep, we don't correct the superficial, the surface wrinkles. It's a bio-restructuring product. So we can use, as I said, for the neck, kamena, and we have to repeat the treatment every 4 to 6 months. So finally, I'm going to finish with one, how we talked about the product. بتصور كلنا فهمنا شو هو. Excellent indications, excellent product. بس أهم شيء I want you to keep in mind the safety. Okay. كل البرودكت بيعطوا good result, but safety عم نشوفها أقل مع البرودكتس لأنه كل الشركات they are aiming to give us a longer longevity, which is very important for the patient. بس بحق شو au prix de quoi شو عم نخسر safety. This product is giving us longevity, but it is very safe, much less side effects, much less hyper-inflammatory granuloma. We're going to take we're going to move differently. We're going to go to the clinic, and we're going to discuss how we have to explain to the patient شو لازم نعمل, what should be done, how it should be done. So imagine that I'm in the clinic now. There's 2 types of patients. There's the type of patient that comes first time, they want a major transformation, and there are patients that please doctor, I want to be very, very natural. My husband doesn't know. If he knows, بيطلقنا, you know, أكيد سامعينا. So هون, this is why our job is to explain to the patient that we can do with the ZHOABEX very natural result, very safe result, and very natural result again. So if we want to go very safely again, and I always will, a divided job is always a better job. So whenever we divide the injection, if I look at the face and I see, you know what, I think that I need 10 injections, which is not a big amount. You know, 10 ml is nothing whenever I'm going to restructure a whole face. 10 ml it's not a big amount. But what we can do, we can say, you know what, let's do 6 mLs today. Let me see you in 3 weeks, 2 weeks, or a month, depends on your timing. Let's do the second session to continue the job. First of all, she will feel more comfortable لأنه بتحس حالها ما حطت كمية كبيرة. And she will see that, look, I injected you 6 injections. Look at the mirror. Can you see a major transformation? No, you just look better. And this is what we are looking for now. Not a transformation, not big changes. It's a better version of the patient. ما بدنا نغيرها, بدنا نحسنها. This is very important whenever we divide the job. And this is a case I saw where obviously we all know that we need like chin, jawline filler, and it's, again, obviously it's very important to do it. I explained to the patient that I have to divide the job for 2 reasons. First of all, financially, because I don't want to inject him 16 injections, because actually I did 16 mLs. I told him that I have 2 things. Yeah, I go aggressively, and we know that if you inject a lot in the same area, the product will move away. So that's why I explained to him that I'm gonna divide the job into 4 sessions, and we can see that there's a major, big, excellent improvement in his case. So we can see the before and after. And it's a different person, it's a different man. So this is one way of thinking, one way of injecting, dividing the job whenever it is needed. While there are patients, they come to inject everything in the same session because they expect, they have a wedding, they have, I don't know, they want a big change. But then when you communicate with the patient, you understand her fear. يعني بتيجي بتقول لها already عملت عند دكتورة بتكون زميلتك وأصحاب معها, she's very good. I didn't see any result. It means that her expectations are very high. So we're not going to do the same mistake. It's not a mistake. We're not going to do the same technique as my colleague did. I'm going to go more aggressively because I want to give her a result that she will see right away. So we can see that in this patient, we did 13 injections in 1 session, and we can see a major transformation in her case. And whenever she came to me, like 2 weeks ago, 2 weeks after the first session, she said, Doctor, I'm not happy at all. قلت لها ليه? I don't see any difference. لأنه it's very natural. Actually كان الله بحبنا إن مصورة. So, قلت لها okay, very good, يلا, you don't see any difference. فرجيتها الفرق, استوعبت. So كمان taking picture is very, very important. Thank you أول شيء لوجودكم. It's always a pleasure again to be in Jeddah, to be in Saudi. ثانك يو انه سمعتوني. ان شاء الله تكونوا حبيتوا كل شيء قلته. حكينا برودكت, حكينا تكنيك. We're gonna inject patients now. We're gonna talk how we're gonna inject, why we're gonna choose this product and not this product. Thank you again for being here. حدا عنده شي سؤال؟